It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives, changing lives, changing lives for the better, changing lives.
Hello everyone, I'm Grace Sells and welcome back for another edition of Best Docs Network, the show that features some of the best doctors in the Houston area that are really changing people's lives. Up first on today's show, we're going to hear from ear, nose, and throat specialist, Dr. C.T. Nguyen.
I would wake up every morning sneezing. You know, I'd go into the bathroom and I'd sneeze over and over again, and really prevented me from doing any yard work. And so I would just kind of stay in the house and as much a filtered environment as possible.
Barry came to see me because he can't breathe out of his nose. He reported having nasal congestion, facial pressure, headache. And in addition to that, he suffered from obstructive sleep apnea that required him to wear a CPAP every night.
It started back when I was in grade school, and it just has gotten worse and worse and worse over the years. And most of the other doctors I've always visited would treat symptoms. I just assumed that's all they could do. And when I went to see Dr. Nguyen, he said, no, here's the problem and here's a solution.
We noticed that Barry turbinate, which are structure on the side wall of his nose, are very swollen, restricting his airway. Also, Barry's sinus narrow and prevented him from breathing well. We discussed those findings with Barry and agreed upon a plan of treatment. First, reducing the size of the turbinate, allowing him to breathe better, and also using a small balloon to dilate the natural passage of his sinus cavity.
It took probably 2 weeks to feel really great. Progressively over that time, the breathing improved. You know, it's amazing. I told him I've never ever been able to breathe through both sides of my nose, and now I can.
After going through a small procedure in office of 45 minutes, now Barry enjoys life, breathes better, do more outdoor activities, and the most important thing, it reduced his dependency on CPAP machine, and he now can sleep better.
I was amazed because it was like finding somebody that was really willing to just do something more than put a Band-Aid on it. It was really exciting.
If you have asthma, don't let it stop you from playing sports. Swimming, canoeing, fishing, sailing, and walking are all asthma-friendly options.
Dorothy, she had multiple teeth that were decayed and she had failing restoration. So she had a history of having multiple dental procedures on her natural teeth. And these restorations had subsequently failed over time, secondary to wear as well as decay.
I came to see Dr. Metz and I was, of course, just knocked out. My heart went, he was so nice and encouraging. He said, yes, I think we can help you.
At 90 years old, she had all her lower teeth removed and placement of 4 dental implants and also placement of an immediate prototype, so to speak. So she had fixed teeth on the day that her teeth were removed.
Right, I had no problem whatsoever. It worked. I could eat and chew and I looked normal. And I was just perfectly happy with it.
Her situation is not unique. There's many people in her age group that just by virtue of their age, their teeth are beginning to fail. Many of them are under the misconception that they're too old to have oral surgery safely. Although by virtue of their age, that age bracket, we do more implants in that age bracket than any other age bracket. So they do tremendously well with it, just like somebody much younger. And also their health improves afterwards.
And I just was thrilled. That first steak was like out of heaven. It was paradise. You know, it was just wonderful. I was so thrilled and happy.
You know, with their fixed teeth, they're able to chew what they want and not foods that are high in sugar. And so they're healthier in the long run. For one, they're not fighting infected teeth. They have a healthier state in their mouth and they're able to chew what they want. And they're able to have a much more balanced diet.
I would say, don't do that. Don't tough it out. Go get something done. Go get some dental implants and be comfortable like I am.
When you ask these individuals after they've had this procedure done, they say they feel more energetic. They just feel better. And then we feel that it's their body not fighting a chronic infection, that they're in a healthier state overall.
BestDocsNetwork.com helps you find the right doctor for your medical needs. Watch videos on each doctor and decide for yourself who fits you best. On the Best Docs Network homepage, you can see the latest videos, search for a doctor, find educational content, and watch the latest TV episodes from each BDN market. All of the doctors that you see on our show today have profile pages on our website, BestDocsNetwork.com, complete with bio, videos, and even a map so that you can find their office. And that includes our next doctor. It's vein specialist, Dr. Peter Morgan.
Well, I had some reoccurring wounds on my legs that just wouldn't heal. It seemed to be worse in the wintertime. Well, I had had them probably on and off for a couple of years, but it seemed to have gotten worse in the end of 2011.
Many of the patients that we see that have wounds have had them for many years. On several occasions we've seen patients that have had wounds more than 20 years. They typically are getting seen at wound care centers or getting treated by a variety of other healthcare providers without success. These wounds occur on the legs. They are frequently very painful. They are not associated with diabetes, which is a common misnomer. They're caused by venous insufficiency or varicose veins.
I had gone to a local hospital, to a wound center, and spent about a month there doing different things, going back every week, and it was no different. And I decided I was just wasting my money there, so.
He came in, we performed a venous Doppler ultrasound on him, diagnosed venous insufficiency. We corrected that venous insufficiency on him using endovenous radiofrequency ablation of the vessels, and all his wounds healed up very promptly, less than 2 months. In fact, some of them were healed within a couple of weeks.
You know, he seemed to have a little bit, better idea what it was. It was a circulation issue as far as the veins, and he talked to me about the different veins that they could do as far as the closing off of things, and I was all for it. He said that he thought it would heal up within no time, and he was correct.
Treating those veins results in relatively rapid resolution or healing of the wounds. Probably the #1 reason why I began to specialize in the treatment of venous insufficiency was that I discovered that it was the solution to these chronic wounds that had previously not been treatable.
Seeing Dr. Morgan, he was very personable. He's easy to trust right off the bat, knew what he was talking about, very friendly staff. Like I said, I've never had any issues since, and I've been very happy with the experience.
To find a doctor on BestDocsNetwork.com, you can search by your location and the doctor's specialty. From there, you can search through the doctors listed. You can even search by your current location to find the doctor closest to you. Taking a multivitamin is a quick and easy way to make sure you're consuming the essential vitamins and minerals you may not be getting from food. Make sure your supplement delivers 400 IU of vitamin D, which is the dose that is said to reduce risk of early death by 7%.
At Houston Northwest Medical Center, our story began 40 years ago when a group of doctors took the risk of building a hospital in the middle of a cow pasture that was at the northwest side of Houston.
As a result of their vision and the quality that they provided, the hospital quickly grew into a regional healthcare provider serving not just the immediate area, but really all of North Houston.
When I joined the hospital 23 years ago, the things that stood out were, number one, the facility itself. The facility was second to none with respect to the services it provided.
Houston Northwest Medical Center is well known for the high quality care it's given since it's been opened. Since the first cardiac procedure in 1984, the hospital has continued to grow.
We do every kind of surgery, from the small to the large. We do from toenails to open heart. We have a very large bariatric program. We did about 500 cases last year.
As the years have gone on, we have been known for cardiovascular surgery. For cardiology procedures, we have a beautiful cardiac cath laboratory. Our OB department has just grown through the years.
Here at Houston Northwest, we have a lot to be proud of, not only in the quality of services we provide, but in the scope of services we provide. We are the third largest ER provider in the greater Houston area, and we're the largest outside of the medical center downtown.
The attention to detail is phenomenal, from the top all the way down to the bottom. We care at every aspect, whether it's quality, compassion, patient satisfaction, and we don't stop till we make sure that our patients are taken care of.
We have excellent staff, excellent doctors. Our nurses have all gone to do advanced certifications.
The nursing staff here are experienced from 1 year to 40 years in terms of providing women's services care. So we pride ourselves on family-centered care.
In the past 23 years since I've been a physician at Houston Northwest, the hospital has grown with the community. And we continue to perform well with respect to quality, and it's a reflection of not only the physician's care, but also the nursing care in the hospital.
Our facility strives to be a leader in technology, which means that we want to be innovative and we want to provide the best care to our patients. That means the fastest care and getting you the service that you need.
I'm really proud to be a part of Houston Northwest Medical Center, and I know in the future that we'll continue to keep up with the highest, most innovative care.
I'm very excited to see what the future will hold. I know that for this hospital, we're ever evolving and improving.
Where we're headed at Houston Northwest, I think, is as exciting as where we've been. First and foremost, we're going to continue to provide the highest quality of care that we can possibly provide.
At Houston Northwest Medical Center, our story is your story.
At Houston Northwest Medical Center, your story lives on.
For more information and to watch hundreds of videos on the amazing doctors that you see on today's show, head to our website. It's bestdocsnetwork.com. Now it's on to our next best doctor. It's Interventional Cardiologist, Dr. Annie Varughese.
I noticed something wrong in July of 2008. I actually went to a routine doctor's visit for some breakout that I had, because I had used a different type of deodorant. And when they took my blood pressure, they said that it was, unusually high.
Hypertension, what can it cause? And some people think, well, their blood pressure is a little bit high, they can take a medicine, or maybe they just don't have to take it every day. A lot of people take this idea of hypertension kind of casually, but we shouldn't, because high blood pressure can cause problems from stroke to heart attack to kidney failure. So many things can be caused by that one word, hypertension.
Ended up inevitably going to the emergency room like a couple of days after because I just started feeling really dizzy, headache. It was as if my heart was actually hurting inside of my body. The blood pressure was 200 over 110. When I came to see her, her first words were, "We're gonna heal you." And I was like, yes, came to the right place.
She has been committed and faithful to take her medicines and to take care of her body to protect her heart, because high blood pressure can lead to many other things, especially cardiomyopathies or weakening of the heart, heart failure from diastolic heart failure or systolic heart failure. So we have prevented that in her, and she's doing very well.
Before, I would feel sluggish, tired, anxious a lot, and a little headaches like that. And then after, once we started treatment on medicine, different medicines, I would feel better. I would feel like I had energy. I just felt better and good about myself.
If the pressure is too high, too much damage can occur in the organs. We have to take it seriously, and we just need to educate patients, I believe. If patients really knew what it was all about, they would come and get checked and take their medicine.
I believe that Dr. Varughese has been blessed from the Lord with life and favor, in her hands. So, and I just love that about her.
Having a scheduled time for eating is a great way to keep your digestive system healthy. Try to sit down for breakfast, lunch, dinner, and a snack at the same time each day.
I just always felt like my body was out of proportion. When I would try on clothes, it was never when I looked into the mirror what I envisioned in my own mind. So I guess that's what prompted me to start researching and looking online. I never felt like my full potential.
Karen came in just wanting to have bigger breasts because she'd always felt that her breast size was out of proportion to her hips. She'd always wanted to be a little bigger. She just felt she needed it to kind of balance out her shape. So she was, after discussing it with her, a really good candidate for that.
As soon as I met his staff and him, I know he had that attention to detail. Just speaking to him, something about him set him apart from the others. He just made me feel safe. I knew I could trust him and his work.
So there's a lot of factors that go into it. By taking the measurements and using them carefully to that particular patient and matching it to the size of the implant, we can give them a good, aesthetically pleasing size and shape that looks good and matches their body.
It was an outpatient procedure, so I came in that morning. The same day I was out and back in home. It was a really good experience.
It really made a huge difference in her confidence and self-esteem. It may seem like a small thing to just someone who didn't know her or just a casual observer, but in her mind it made a world of difference. It just really changed her personality. She kind of brought her out of her shell. She just felt better in a bathing suit, in photographs, just being out socially. So it was really a real blessing for her overall.
Before my breast augmentation, I was wearing a size A. And after the augmentation, I was a C. I had already decided I wanted a very natural look, and that's something that's very important to me. That is what Dr. Altamira gave me, a very natural look, and I'm very happy with the results.
Each doctor on the Best Docs Network website has their own profile page where you can watch videos on the doctor, read info on their background and training, find their office locations and directions, as well as ask the doctor a question and request an appointment.
You hear a lot about probiotics nowadays. A lot of people take probiotics. In some cases that's good, in some cases it's not going to help much. Probiotics are microorganisms that people take and it gets in their intestines and populates their colon with the good kind of bacteria, like the lactobacillus, for example. There are lots of different kinds of probiotics, and in general, people that are healthy and are having no gastrointestinal symptoms don't need them. However, if you've had a lot of diarrhea, let's say you have a lot of gas, either from the upper end or the lower end, or let's say you just have a lot of bloating and feel bad, probiotics may help you. Don't get the expensive brand name stuff over the counter, get the cheap stuff. Yogurt may work sometimes, but generally the probiotics that are over the counter are more concentrated than the yogurt. And it does repopulate your colon with the right bacteria and can help you with everything from gaseousness to diarrhea. That's a crowd pleaser. Go ahead and take it. It might help you.
For additional medical minutes from Dr. Honecker, log on to bestdocsnetwork.com and click on the Medical Minute tab on the home page.
Well, the spa dentistry concept is something that I am considered one of the pioneers in the spa dentistry field, because I started doing this probably about 20 years ago. It feels like a high-end spa. It feels more aesthetically pleasing. One of the things we started with was just, how the staff was dressed. A lot of them we dress in black, which is a little classier looking. When you walk in, you can tell you're not in your typical dental office. I mean, most people are like, wow, this is unbelievable, because it's very nice. It's kind of like walking to someone's living room. The rooms that I treat patients in are more like suites. They're big rooms. They're not real closed in. They have couches in them so that family members or friends can come in and sit and be with them if they want to. But we also have TVs that are not only up in front of you where you can see them when you're sitting up in the chair, but we also have TVs in the ceiling so that when you're laying back in the chair, they're flat-mounted large screen TV, so you can watch TV, watch a movie, be relaxed, have your own headset, kind of go away, not have to hear all the sounds that are going on. We also have massage therapists that could do foot massage or hand massage, hand paraffin treatments for ladies, especially. Guys like it too, but where they can dip their hands in the hot paraffin and get that done. Just little touches that make it different, make it more of a relaxing experience. Most people equate going to the dentist like a trip to the dungeon, and it just doesn't have to be like that. It can be nice, it can be comfortable, it can be actually relaxing. And we have a lot of patients who tell us, I love coming here and I love getting this done. It's no big deal. It's not like, I heard my parents talking about. This is totally different. So we've done a lot of different things to try to make it different from just the norm and different from what everybody else is doing, and make it special, make them feel at ease.
To request an appointment with any of our outstanding doctors that you see on today's show, head to our website, bestdocsnetwork.com. Go to the doctor's profile page and click on the Request an Appointment tab. You can even request an appointment with our next doctor. It's Podiatrist Dr. Gabriel Maislos.
First started having some pain in my right foot after an incident stepping out of a pool. And I thought it was just a simple bone bruise, but then I had some numbness. And so I went to see some podiatrists, and initially they felt it was related to my diabetes.
When he came into my office, he complained of shooting pain in his toes. So after doing an examination, an ultrasound exam, and then he exhibited signs of a neuroma. A neuroma is essentially a nerve that is compressed by the sides of the metatarsal. So the nerve courses in between, and with a neuroma it becomes inflamed. And after a while it develops like a fibrous sheath, and it's no longer just inflamed, it's enlarged.
In terms of quality of life, I'm a big golfer, and it was really made every day, and certainly the enjoyment of playing golf a lot less enjoyable because of the problem.
So Mr. Weber came in with the symptoms of a neuroma, and I believe I treated him a couple times with sclerosing injections. Orthotics were given to him, and as well as instructions on stretching and taking an anti-inflammatory. And he just didn't get better. So at that point, he elected to have surgery.
Well, I think certainly in my case as a diabetic, and given that the symptoms are so similar, that this could happen to other people. I wasn't even aware of what a neuroma was, and being a diabetic, so I think just awareness is a key to understanding that Numbness doesn't always mean diabetic neuropathy, and it could be an actual injury to your foot, and you should see a podiatrist.
The procedure, it's very rewarding because patients like it, and there's minimal pain postoperatively. If anything, there's some temporary numbness, and then after a while, patients regain sensation.
My experience with Dr. Maislos, what I like about him is he is very circumspect. So he doesn't assume anything. Let's go through all the steps. He's really interested in finding a solution. Very pleased with the care that the doctor has given me.
Hi, I'm Dr. C.T. Nguyen with Houston Sinus and Allergy and Best Docs Network. Do you know there's a simple solution to reduce your allergy symptoms? Wash your hair at night. It removes pollen and dust so you don't breathe them in while you sleep. To learn more on this and other topics, please watch my video at bestdocsnetwork.com.
BestDocsNetwork.com also has a video library of all the doctors' videos that you can break down by doctor, topic, and specialty. This is a great way to find videos quickly and watch all the videos associated with your needs. Nuts are not only a source of healthful fats and protein, they also are a massive dose of omega-3 fatty acids that can help boost your brain power.
Lethargy, just tired all the time. Anxious, couldn't let my mind relax. Paranoia, and the paranoia was the thing that was destroying me. I just doubted everything that was said to me. I didn't think I was being told the truth. I was looking for anything I could find to prove that something was wrong in my marriage. I was completely convinced that I was headed towards the end and trying to figure out my life.
Samantha came in with mood challenges. She had a lot of issues right before her cycle. About a week or two before it happened, she would definitely notice that her moods would change. She would have more irritability, more anxiety.
From the moment she told me she could help me, I think my mind already changed a little bit. Was I skeptical? Yes. But when I started taking the hormones, which is just progesterone, I honestly believe it was within like a week or two that everything started to change.
Around the mid-30s, or even after we've had 1 or 2 children, we certainly notice a decline in how we feel, and that starts the imbalance of how our hormones start to change. And so during that period of time, we get a phase called estrogen dominance. So if we're able to take that progesterone and rematch it to the estrogen, we are able to correct the heavy periods, the PMS symptoms, the bloating, the irritability, the anxiety.
Oh, it's been over a year that I've been better, and I will never go off of these hormones if I can help it. I know people think, is this a short-term fix? Can I, once I get better, can I stop? And you know, I've been told that no, this is it. These hormones aren't going to come back naturally. You have to continue, and I'm okay with that. I'm perfectly okay with that.
So we can have women who literally can't leave their house. They're so anxious, they're so depressed, they have so many mood challenges. And with progesterone, we're able to completely correct that. Samantha, once she was treated, her whole life was completely different. She was able to function so much better, her family was much happier, and really that made a huge difference in her ability to continue to function as a normal human being. I mean, she's able to just go out there and do what she needs to do and not have to worry about these severe mood swings anymore.
That's going to wrap up this edition of Best Docs Network, the show that features some of the best doctors in the Houston area that are really making a difference in people's lives. For more information, head to our website. It's bestdocsnetwork.com. And if you have a question, a comment, or a life-changing story of your own, send us an email at info@bestdocsnetwork.com. Thank you for watching, and I'll see you next week.